Hello everyone, my name is Danis Whiskers and this is vemonline.net. In this short video we will talk about infraspinatus muscle. Infraspinatus is another muscle of the SITS group, that sits muscles. Those are supraspinatus, infraspinatus, teres minor and subscapularis. Let's take a look at the anatomy of infraspinatus muscle first. So again, we are talking about origin, insertion, action, nerve supply, blood supply, and synergists. Most important are definitely first three. So where does it start, where does it end, and what type of action does it produce? What type of movement does it produce? Infraspinatus muscle, as the name states, originates from infraspinous fossa, that's below the spine of the scapula. Supraspinatus above spine of the scapula, infraspinatus below spine of the scapula. It inserts into the greater tubercle of humerus, that's middle facet specific. Insertion is slightly lower from the supraspinatus insertion. Supraspinatus is attached to a superior facet of the greater tubercle of humerus, infraspinatus middle facet, so slightly lower. Because of that, it will be able to produce rotational movement, and we are talking about external or lateral rotation of the shoulder joint, or actually we're talking about humeral bone that's going to rotate. So external rotation of the humeral bone. External rotation of the humeral bone is the main function of infraspinatus muscle. But just like all the other sits muscles, it will act as stabilizer of the glenohumeral joint as well. Infraspinatus muscle is innervated by suprascapular nerve, that's nerve root C5, C6. It is supplied by suprascapular artery and scapular circumflex artery, that's blood supply. Synergists, those are the muscles that work hand in hand with infraspinatus muscle. So they are producing the same type of movement. Those are teres minor and posterior fibers of deltoid muscle. Teres minor and infraspinatus muscle are the most important external rotators of the glenohumeral joint. Now this is very, very important, and those are the ones that will have to be strengthened if there is something wrong with the shoulder joint. If you're going through a rehab, most likely a therapist will ask you to strengthen teres minor and infraspinatus muscle. Activities of daily living. So where do we need this muscle? What type of activities is it going to produce? So for example, brushing hair, so reaching behind your head, that will be one. In a racket sport, so let's say for example tennis, backhand. And in throwing sports, let's say for example baseball or javelin, it'll be the cocking phase before the throwing motion. Important clinical notes. As we already learned, infraspinatus is rotator cuff muscle, so that's SITS or sits muscle. Those are supraspinatus, infraspinatus, teres minor, and subscapularis. Infraspinatus muscle tendon blends into the glenohumeral joint capsule. That's quite important. So basically insertion is part of the capsule as well, in other words. Infraspinatus muscle may be weakened or even paralyzed with upper trunk injuries to brachial plexus. Let's take a look at the most common injuries. Rotator cuff tear, now that'll be number one. That's at the top of the list. Bursitis, that's number two. Bursitis, that's inflammation of the bursa. Itis, wherever you see a condition with itis at the end, that means that there is some kind of inflammatory response, some kind of a condition with inflammation, with swelling. So what bursa really is, it's sort of like a cushion, like a pillow right underneath the tendon of the muscle. It will reduce the friction of the tendon rubbing against the bone. Let's say if there's some kind of a compression injury, some kind of a blow to the shoulder, that bursa could be damaged, and if it's not healed properly, that inflammatory response, it can continue, and when you use your shoulder again, it just happens again and again, and we are in this circle of the repetitive type of stress, and it's already like a chronic injury. Rotator cuff injuries will have tendency to get into this chronic stage. That's why we have to be really careful with any type of injury whatsoever. Myofascial trigger points. Now this is really common, and the perfect example would be servers or waiters. Now these people walk around carrying trays in this externally rotated shoulder position. Now let's say we are doing this a couple hours a day, maybe 3, 4, 5 hours a day, 6 hours a day, every day. These muscles are just gonna be overworked. So external rotators of the glenohumeral joint, they just don't get rest, and they will develop these particular fibers in the muscle that are going to be tighter than the rest. And somewhere along these fibers there's going to be this exquisite nodule of tightness, and that is called trigger point. We'll probably talk about this sometime later on in our future videos. This is a very interesting topic. Adhesive capsulitis, that's number 4. In layman's terminology, we call this just frozen shoulder. Adhesive capsulitis, basically adhesive, you know what adhesion means. That's like it's fibers are glued together, there's no movement. So capsule that doesn't move, basically. Now these people will go through very painful therapy if they want to improve their quality of life. So basically with this condition there's going to be restricted range of motion. Active range of motion is going to be less than normal. This condition is so-called idiopathic condition. So sometimes it starts out of nowhere. It doesn't really have to be connected with some kind of a injury. So sometimes it just happens, and one day you wake up and you can't move your shoulder. But usually people that work above their head, so let's say for example electricians, or let's say for example carpenters that do drywalling, so they'll do drywalling, they'll do the ceiling, so some kind of like pushing weights against something above your head, or let's say painters, for example. So people that will overwork this that particular range of the shoulder joint, and in particular we're talking about some kind of overhead work. So these people are going to be more affected than the rest, but not necessarily. Sometimes it just starts, and sometimes it actually just as sudden as it starts, it's so sudden it will actually resolve as well. So it starts out of nowhere and it resolves out of nowhere sometimes as well. But most likely in this condition, if it's already in this chronic stage, it will take at least 1 to 1.5 years for it to resolve, and it's usually a very painful process. Some type of brachial plexus injury or compression or suprascapular nerve entrapment, that would be number 5. A good example would be upper crust syndrome. Now this is a condition where underlying nerve tissue is compressed by overlying structure. For example, clavicle or scalene muscles, those would be the most common cases. Muscle infraspinatus is innervated by the nerve that comes off of the brachial plexus. And if brachial plexus is compressed, infraspinatus ability to perform is going to decrease, obviously. And the last one, that's number 6, is arthritis. So some type of arthritic condition. What arthritis really is, it is a condition where cartilage that's found on both joint surfaces is for some reason either damaged or worn out. So basically we are talking about bone on bone rubbing. So there are going to be exposed spots on that cartilage lining where there's no cartilage basically, and if those spots connect, there's pain, and sometimes that pain is severe. So sometimes some of these people with very severe arthritis will actually need joint replacement. So basically cut the joint out, replace it, that's it. Not much you can do about that. So this is it for infraspinatus muscle. Thank you for watching. If you found this useful, please share this with your friends. Click on that subscribe button, please help us grow. We are a very young channel, we started this literally just months ago. I'm making 1 to 3 videos every week. If you'll click it, you'll find out about it, and I'll see you soon. Bye bye.